Tip rhinoplasty. Oftentimes patients who come in for consultation are concerned about their tip shape, either being too bulbous, round, out of proportion, too large for the rest of the nose, when the rest of the nose, the upper bridge, is nicely proportioned, and they like that, but it's the tip that bothers them. What is a tip rhinoplasty? Basically, it's reshaping the tip in a more aesthetic way so that everything flows into a more delicate, refined, feminine or masculine looking tip, and everything balances and harmonizes. The goal always is to have the nose just blend in very nicely to the facial background, and so that it doesn't stand front and center, taking attention away from the eyes or the lips. So tip rhinoplasty is a very powerful technique to shape the cartilages underneath the surface of the skin, and I do this routinely through a closed approach, meaning hidden internal nostrils and incisions to get access to the curved cartilages that make up the tip structure. If you think of the curved cartilages underneath the surface of the skin as horns, like the horns on a ram, so to speak. There are curved cartilages that curve around, meet in the middle at the very tip of the nose, and then curve underneath to make up what's called the columella. Those curved cartilages are often too wide and full and too big, so I can access them through hidden nostril incisions, expose those big ram's horns, so to speak, reduce them, shape them with suture techniques, sometimes with cartilage grafting techniques, to create a beautiful, refined tip, create a little bit of lifted shape, which oftentimes patients want, and improve asymmetry as well. If there's deviations of those cartilages such that the nostrils look a little bit different, we can often correct that as well. So tip rhinoplasty, very common procedure that I perform for patients who just want refinement of the tip. We do it under light anesthesia. It takes a couple of hours to do, can recover comfortably at home. The recovery is very simple, minimal discomfort, and we can get results within about a week. So recovery is very straightforward. Very powerful technique and very effective to give patients a more balanced result.